Hi, I'm Melanie McNeil, and I'm a physical therapist.
And I'm Megan McKay. I'm an athletic trainer, and we are part of the Division of Sports Medicine and Orthopedic Surgery at Baylor College of Medicine.
Today, we're going to demonstrate what exercises you need to do to prepare for knee surgery. These exercises should be performed on a firm surface. So before surgery, it's very important going in that you get your knee fully straight. Okay, so we're going to start with a seated hamstring stretch, okay? Megan, I want you to push your leg on the floor, okay? And the injured leg is just relaxed, and it may hurt, but that's okay, okay? You're just stretching structures that are tight. So I want you to take both hands and reach them straight out. Okay, sit up nice and tall for me, and then bend forward at the waist. Okay, and it's okay if your knee doesn't go all the way down, just try to relax it, okay? You should feel it pulling all the way down your leg and even behind the knee, okay? Studies show if you hold a stretch for 30 seconds, it's better than 15, but no better than 60. So we hold it for 30 seconds. Okay, you're gonna hold it for 30 and then you can relax, and you'll do 3 of those. Now, if sitting in this position, maybe if you don't have a table or it's difficult to get in this position, you can also stretch your hamstring on your back. Okay, now we're gonna do a supine hamstring stretch. Supine just means lying on your back. So we've looped a towel around Megan's forefoot, okay, and I'm gonna help her bring her leg up in the air. She's gonna grab both ends of the towel, okay, and then we're gonna work to straighten her knee, okay. When you feel a good pull behind the knee, then you're gonna hold the stretch for 30 seconds, rest 5 or 10 seconds, and repeat it 3 times. Now we're gonna move to the calf, okay. The calf actually originates above the knee, so when you try to straighten your knee, you're going to feel a stretch there as well. So I'm looping the towel around Megan's forefoot, or the ball of her foot, okay? And she's going to pull her toes back, pull on the towel to pull her toes back as far as she can, okay? Now she's going to sit up tall and then actually lean forward a little bit at the waist. And the goal here is to get that knee fully straight. So you're really working to push that knee down. You're gonna feel it behind your knee in this stretch. Again, you're gonna hold the stretch for 30 seconds, relax 5 or 10 seconds, and do 3 times. So if you've done those 3 stretches and your knee still isn't straight, there's one more exercise I'm gonna show you to help get it straight. And that's called a prone hang. Prone means lying on your stomach. So make sure your kneecap is not hitting the table, because that is not going to be comfortable. And then you just want to relax and let go. She's holding her right foot now. I'm just going to have her let it go and try to let it relax. It's really not going to be very comfortable in the back of the knee here, but that's okay. You're just pulling and stretching all of this out. And your goal is to lie there for 5 or 10 minutes just relaxing. Try to watch TV, play a video game, text someone, get your mind off of it, because it's not going to be comfortable. If it's too painful, hold it for a minute and then use the other foot to kind of provide some relief for a few seconds. And then when you can tolerate it, you can start over again. So now your knee should be fully straight. And that's really important for the next exercises that we do, because we're going to work on getting the quad firing. And in order for the quad to fire, your knee needs to be fully straight. So that's why you need to do the stretches first. After surgery, the VMO, tighten one more time, this is the part of the quad that's going to atrophy the most, okay? So going into surgery, the studies show the more you build it up, the better your outcomes are going to be. Okay, Megan, I want you to, on your uninvolved leg, I want you to tighten your quad. Squeeze and tighten. You see how you get some hyperextension there? Your knee goes down and your heel comes up. That's excellent. Relax it for me. So, Megan, I want you to tighten both quads now. During that 10 seconds, you hold it as tight as you can. 10 seconds on, 10 seconds relaxing. And Megan's going to do this for 10 minutes. Next, we're going to do straight leg raises. These follow quad sets. So Megan is lying on her back here in a relaxed position with her non-involved knee bent, foot flat on the table, okay? So what I want you to do, Megan, is tighten your quad, get that knee fully straight, lift your leg up just about 10 inches, okay? Keep the quad tight, tight, tight. Hold it a few seconds. Now when you lower it down, I want you to try to touch the back of your knee to the table before your heel. Okay, you're going to repeat that 10 times and then take a minute break. You'll do 3 sets of these. So when you're sitting, your hip flexor is actually in a shortened position, so it forces the quad to work harder to do the same motion. So Megan, I want you to tighten your quad, keep it tight, lift your leg up, Hold it a few seconds and see it's a little bit harder to keep your knee fully straight in this position. And then lower it down. Again, trying to touch the back of the knee first. Again, when you start these, you certainly wouldn't start these doing with ankle weights. You want to do it with just the weight of your leg, and then as you get stronger, you can add ankle weights if need be. So now your knee's fully straight. We got your quad firing. Now we need to work on bending the knee, getting full range of motion, or as much as possible before surgery. So we're going to do what's called heel slides. So I have a towel, and we're just going to loop it around Megan's right foot. She's going to hold it. Now, your knee's going to be stiff because you've been doing everything to get your knee straight, okay? So this is not going to be very comfortable initially, okay? But that's okay. So I want you to relax your leg on this one, okay? Just let it go and pull with your arms, bend your knee, and slide your heel up the table as far as you can, okay? When you feel pain, you stop, you hold it a few seconds, and then let it go back down. You may only be able to go 5 or 10 degrees the first time. That's okay, okay? It's going to loosen up with time. You're going to do these for about 5 minutes, just up and down, holding it at the top just for a few seconds, letting it go back down. So what we're looking for is near full range of motion. The studies show really going into surgery, you want 0 full extension to 130 degrees of flexion. 130 degrees of flexion is almost full range of motion. Okay, so this is your goal going into surgery. So before surgery, you want to walk normally. To do that, we're going to do what's called cone walking. So I've set up some cones, just some styrofoam cups you can get. Put them down about 1.5 feet apart, okay, and Megan has her crutches. And so what we're going to do is we're going to work on stepping over the cones with the normal gait pattern. Okay, so Megan, I want you to bend your right knee up as far as you can, okay? Step over the cone and land with your heel and then put your foot flat. Go ahead and bring your crutches up so they're even with that foot. Now I want you to tighten your quad to lock the knee out, okay? Shift your weight to your right foot, keeping that knee locked, and step forward with the left foot. Now bend the right knee, roll over your toes, lift it up over the cone again, landing with your heel. Bring your crutches up, tighten your quad. Tightening your quad is going to keep your knee from buckling or hyperextending. Here are the goals going into surgery. Full knee range of motion. That means being able to fully extend or straighten your knee and bend it as much as possible. Walking with a normal gait pattern. As little effusion or swelling as possible. Activating your quadricep muscle by tightening your quad.